download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. In a miraculous rescue, doctors at Fortis, Nagarbavi successfully helped save the life of an 8-month-old baby who had accidentally swallowed a 2-centimeter bottle cork while playing. Dr. Narendra A, consultant ENT specialist, along with Dr. H.K. Sushin Dutt, senior consultant ENT specialist, removed the cork with the help of laryngoscopy. With the correct diagnosis and timely medical intervention, the baby was saved. After accidentally swallowing the cork, the male infant had gone breathless and had become unresponsive. He was taken to 3 hospitals, one after the other, for a week, where the doctors suspected the child had a lower respiratory tract infection and prescribed nebulizer treatments. The National Medical Commission has released the updated phase-wise academic calendar and curriculum for the MBBS batch going to be admitted this year in the 2022-2023. This updated calendar lays but the entire MBBS course plan for students this year, specifying the details, including phase-wise curriculum and hours allocated for learning, clinical postings, schedules, electives to choose from, as well as key changes from Graduate Medical Education 2019. According to this calendar, the total time for teaching and learning to acquire the MBBS degree will be 6,864 hours over 176 weeks, and clinical postings will take approximately 132 weeks. In the earlier schedule, the total duration for the MBBS course was slated to be 66 months. The first and the second year MBBS batches last for 13 months each. The National Medical Commission on Tuesday has given its approval for change in the name of Ahmedabad Municipal Corporation Medical Education Trust Medical College, Ahmedabad, to Narendra Modi Medical College, Ahmedabad. The NMC wrote to the Dean of the Medical College to convey the go-ahead by the Medical Assessment and Rating Board for change in the name of the institution.
A 3-month pilot study of patients with hypertension demonstrates that adding yoga to a regular exercise training regimen supports cardiovascular health and well-being and is more effective than stretching exercises. The incorporation of yoga reduced systolic blood pressure and resting heart rate and improved 10-year cardiovascular risk. For the study, investigators recruited 60 individuals with previously diagnosed high blood pressure and metabolic syndrome for an exercise training program. Over the 3-month intervention regimen, participants were divided into 2 groups, which performed 15 minutes of either structured yoga or stretching in addition to 30 minutes of aerobic exercise training 5 times weekly. In rural Bangladesh, areas with high levels of arsenic contamination in drinking water compared to areas with less contamination have a higher prevalence of antibiotic-resistant Escherichia coli or E. coli in both water and child stool samples, according to a new study published in PLOS Pathogens. While the major drivers of antibiotic resistance are the overuse and misuse of antibiotics, natural elements such as heavy metals can also promote antibiotic resistance. There are some benefits and potentially serious risks when people with heart failure use complementary and alternative medicines or CAM to manage symptoms. This is the recent scientific statement of the American Heart Association published in the journal Circulation. They recommend involving the healthcare team for safety. The statement defines complementary and alternative medicine therapy as medical practices, supplements and approaches that do not conform to the standards of conventional evidence-based practice guidelines. Complementary and alternative products are available without prescriptions or medical guidance at pharmacies, health food stores and online retailers. In patients with hormone receptor or HR-positive, HER2 negative tumor resistance to aromatase inhibitors, the addition of the investigational AKT inhibitor Capivasertib to fulvestrant doubled the median progression-free survival compared with placebo plus fulvestrant in the phase 3 CAP-ITELO 291 clinical trial. The trial aimed to determine whether addition of the potential first-in-class AKT inhibitor Capivasertib to fulvestrant would improve outcomes in patients with HR-positive breast cancer whose tumors had developed resistance to an aromatase inhibitor. The researchers randomly assigned 355 patients to receive Capivasertib plus fulvestrant and 353 patients to receive a placebo plus fulvestrant. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.